Hello YouTubers, welcome to my channel Tech World. Today I'm gonna be looking at a few products here that is gonna help us with our health and well-being. And during this time here where we're staying at home, we have a pandemic that is obviously affecting our lives currently. I think it's important to address the topic of our health and how we can safeguard our health for the future. I've been testing a few products here that I went about and purchased myself that is going to help us to track our health and help us to make better decisions on how we take care of ourselves and give us information about what our body is doing and changing as we continue to monitor this virus and also monitor our family health, which is hand in hand with each. So what I have on the desk here is a array of health products or health technology products that's going to assist in informing us to make good decision in our health. It's going to help with quarantine ourselves from our family, especially if we show symptoms of COVID-19, and also safeguard the future so that if there's some early detection signs of diseases that maybe with us that we're not aware of, we can probably pick that up in this array of equipment I have here. So just off the bat, the easiest equipment that you can go out there and purchase right now, if it's available, is the infrared thermometer, which is a no contact forehead thermometer. It is a beautiful design. It's made by a company called iHealth. PT3 is the product number. And as you can see, it's a pretty glossy finish in front. Then you have these two infrared beams that comes out. Takes the AA battery, and then it has this sign of a thermometer in front. This product is really simple to use. You can use it anywhere, and don't need any professional degree to use this product. It's just a matter of a quick infrared temperature scan on your forehead, and it tells you right away what's your temperature in your body. Obviously, if there's a temperature that's above 100.4, then there's early signs there that you might be experiencing a COVID symptoms or some sort of infectious disease that your body is trying to combating internally, and that's causing that extreme temperature in your body. I'm not a doctor, so I obviously don't want you guys to be misinformed with my level of knowledge about medicine, but these are signs that you can tell whether it's your kids or someone that's elderly in family. By taking this thermometer and doing a quick infrared scan on the forehead, you can detect the body temperature and how the body is behaving over a period of time. So I would use this early in the morning when I wake up to get an assessment of my body temperature if I don't notice it myself. And let's say I go out and I come back from the store, within a few minutes I would do an infrared scan to get an assessment of my body temperature and how my body is behaving during those periods of exposure. So how this works, obviously I went ahead, the battery's inside, and you basically take this here towards your forehead. So let's say this is your forehead. Take it towards your forehead. Doesn't need to make full contact to your forehead. You just press it once, and it sends the infrared beam onto your skin, which tells you the body temperature. So right now you can see my body temperature is 97.1. It will fluctuate 1 or 2 degrees Fahrenheit over or under. So sometimes it's best to take it like 3 times to get a real accurate assessment. So first it was 97.4, now it's 97.1, and the third time it's 97.1. So you can safely say that you're under the 100 degree Fahrenheit, so you don't have much concerns there, but it's really useful to continue to take your body temperature with this infrared temperature scan. It's also great for workplace, or let's say you have a private office and you have visitors coming in. Before they enter, you can just take the temperature, just because you don't want them coming in and being exposed to yourself or your family if they have any signs or symptoms. So that is it for this infrared thermometer. Currently, I think it sells for about $59 in the US. And if you stay to the end, I'll tell you how you can pay for all this here without using your personal money. So this is a great tip that's coming up in the end of the video. So if you want to skip ahead, you will get that tip. But all this product that I have here, you can pay for without using your available money. But this only applies to US residents. So it doesn't apply to folks that are watching internationally. It only applies to US. So I'm not sure what the health regulations are in other countries, but I know in the US, this can all be used, all be paid for by a program that's available to US residents. So we're gonna put the thermometer to the side. And the second thing that is really important and useful for COVID-19 specifically is this iHealth wireless pulse oximeter. You can say oximeter, pulse ox. It goes by different names. But like the thermometer, this also uses infrared light to tell you what is the vital signs of your oxygen saturation in the blood. So I know that's a lot of words, but essentially what it means is it's the percentage of oxygen that's getting absorbed in your blood, and that percentage, the higher the number, the better it is in terms of the oxygen saturation of your blood. If it's low, that means low number of oxygen molecules are going into your blood, which causes a lot of complication. Specifically for COVID-19, we've noticed a lot reading CDC website that when individuals show oxygen saturation level of below 90%, typically that is there's some underlying health concerns that's causing the body to absorb less oxygen molecules, and that is also signs of high temperature and a lot of other different concerns in your body. So what I usually recommend is, or what they usually recommend to use this is, check it as often as possible. You can even keep it in your finger for 5-10 minutes just to get an understanding of your body oxygen saturation and how rich that oxygen level is in your body. And if it is really rich, that means you're slightly out of the woods of COVID-19, but mostly in other health complications. If it's under that 90%, obviously you want to get more information by go visit the doctor, etc. So this product also is made by iHealth, and it's one of the products that they offer. I think it's about $70 USD. Design wise, it's similar to the thermometer. It's a glossy finish in front, scratch resistance, no fingerprint. At the back of it, there's a QR code that tells you how to read it or information about it. Has the iHealth logo. On the side of it has the disclaimers on how to use it and how to recycle the product. There's also a charging port where you can charge. It has an internal battery, so it does need to be charged, lithium ion. And then it has, on the other side, it has where it's made. It's made in Taiwan, the lab that makes this device, and other information in terms of voltage and regulations for control, and there's a serial number on it. So this device, really nice, lightweight, compact, portable, and really how it works is very simple. There's a display on this screen here that will tell you your oxygen saturation level. So basically you just pop this open, you put your index finger inside, and once it's inside, you press this little button on the top here, and it gives you the reading. You wait a couple minutes, try to do this while sitting down, and you will see your reading right there. Right now it's saying SpO2 percentage 99%, which is really good. That's probably impacted by I'm sitting down, I'm not standing or lying, so it does show a high, almost perfect oxygen saturation. That number never really gets to 100. I've tried it a couple of times. I've never seen it at 100. It sometimes dips to 98 to 97. Don't be alarmed. That's usually, that's just infrared. There might be a percentage or two that might be off, but I recommend just keeping this on has this gauge here that continuously show that it's sending this infrared beam into your finger to detect the oxygen saturation. And then right beside it has a display which displays your blood pressure measurement. So it does tell you, what's your heart rate currently in terms of beats per minute. So you see this now will go up and down, depend on your breathing, depend on your motions or what you're doing or what you've done, or if you consume a lot of caffeine, that number will be high. I usually drink a lot of caffeine. In fact, I just had a cup of tea, which obviously you see the number is quite high. If you're sitting down, that number is usually around the 70, 75 area, but it all depends on so many other factors. So I don't want to tell you too much what that number should be. There's many factors that would make that number differ in terms of age. And alright, so the third product that I want to show you guys is the iHealth blood pressure monitor. This the design is fairly standard. You have this huge box in front with the same information where you will see iHealth. There's a Bluetooth signal. This does connect via Bluetooth, so it doesn't have a LCD screen that tells you your blood pressure. You actually have to use an app, and I'll show you what it looks like in the app. So it connects Bluetooth to your phone, which relays the information from this measurement device onto the app, and allows you to store the information for future reference. It does come in this nice pack here where it makes it portable, so you can travel with it wherever you go. And there's so many screen. You'll notice there's like a bar that's sliding up that's giving you signal back from the blood pressure monitor, and then there's like a heart rate beating emoji there that's like simulating the heart rate. And as it's continuing to inflate the cuff, you will see readings are showing up on the screen. So right now you can see my systolic pressure is 144, my diastolic pressure is 92, and my pulse is 93. Like I said, I'm not too concerned. I had a lot of coffee earlier, so usually ideal blood pressure is between 120 over 80. So I'm slightly high, but that can be explained through lots of coffee. Alright, so the last medical device for do-it-yourself at home medical information that I want to review today is this small little device here that is made by KardiaMobile 6 lead. I've seen the ads on TV and I was quite curious, and I want to know if there's something that would worth me investing the money in. And honestly, it is my most favorite medical device to use, to play with. It's a lot of fun, and the information that it provides you is just tremendously valuable, and it could save your life. So I'll talk a little bit more about this product, and explain some of the great features about this product. This is the box that comes with it. You'll see Kardia. Alright, so here I have the app, and you can see on the app it's quite simple. It just has your name, and then it has electrocardiogram EKG. It has the last time you recorded, then it has a history of all your recording. Let's close that for now. It has the blood pressure information. You can actually link your blood pressure data to this device or the app. It has resting heart rate information, and there's a subscription for premium protection, meaning that you can send all the information to your physician for review. Then it has information about your weight, and basically pretty simple. There's a lot of information here, so if you're really seeking knowledge and information about everything related to your personal health, this is the place to go. It has tons of data, and basic reference to medical conditions and all that stuff you can read about. So let's quickly record an EKG, and you can see what that looks like. So you basically just press on this little option here. It gives you the description for how to take it. So it says touch the electrodes to start the recording. Today I'm just doing the 2-lead. Your recording will start once you touch these 2 electrodes. The basic information here, the logo, which is this logo here, would be in the opposite direction of a V. So it'll be a V that's in the opposite direction, inverted V. Once you make contact with these 2 electrodes, it will just start recording. So I'm just going to use my 2 fingers to make contact. It will light up green, and then it will start doing the recording. So I don't know if you guys can see on the screen, but you'll see the screen start the recording. I'm going to put a photo of this here in the box so you can take a look at. But you'll see it has it has the emoji that is displaying your beats per minute for your heart, and then it has a countdown there of how long you need to keep holding the electrodes to take to get that gathered information off the EKG. Now once you get the recording, you'll be able to save that on the app, or you'll be able to send that to your physician if you have the premium protection plan with Kardia. So let's wait around and see what this final result is going to be, and then I'll post that on the screen above. Alright, so let's continue to take these looks like scrabbles, but it's very important information about your heart. So signal is recorded. So it's gonna ask you if whoever created the app in the first place, you are usually the owner. It's gonna ask if this is your information, the owner of the app, or the owner who created the app. That information gets posted on your profile. So I'm gonna say yes. Once you say yes, it gives you a little summary of the signal. So it says here, no rhythm abnormalities detected in your EKG, which is, peaceful, gives you peace of mind. You can share the PDF of the signal to someone that you know, or you can have this sent directly to your clinician for review. You could also make a note on, let's say, the day you took it, how you felt. You can add a note, and this recording will be linked to that note for later review. But that's basically it, and this is fun. I can play with this all day, but some people, if you want information on exactly what all the hills and valleys or on the signal is called, you can actually get the information right here. It says learn more about the signal. But this is something that'll be helpful. Let's say if you had some congenital disease in your heart, or let's say you have some condition that you're concerned about. Let's say it's genetic, or it's within it's a known issue that you continue to deal with. This will be something really useful to have for anyone that suffers from those illness, or for the lay person that's always obsessed about their health. This will be something useful to have to give you peace of mind and reassurance that you're okay. So, in summary, the three products that I displayed earlier, the infrared thermometer, the oximeter or pulse ox, and the iHealth blood pressure monitor. Those 3 devices are sold by iHealth. and the Kardia is sold by Alvacor. So all these devices here will look at your heart, will look at your oxygen level in your blood, would look at your body temperature, and would look at your blood pressure. So those are really the most important part that you can detect at home from this device. But what's most important about this here, this is all covered by an FSA account or an HSA account. For the folks in the US, FSA is a flexible savings account that usually many employers will add some funds to it, and you will accumulate funds inside your FSA account. And once you have money in your FSA account, you can only use it for, let's say, visit to the doctor or any sort of medical supplies. You would use your FSA account to take money from that account to pay for those, let's say, surgery or any sort of health needs. That money you can't use as cash for your own personal benefit. It has to be linked towards a medical use. So all these devices here are do-it-yourself home diagnostic tool. And the really cool thing is iHealth. If you go on the website right now, you can use your FSA or HSA, with your health savings account that you have with your employer. You can use that card that they provide to you to pay for this. So it's absolutely no money that's coming out of your bank account. It's coming out of your employer's health savings account that they've contributed towards your health plan. Same goes to the KardiaMobile. If you have a FSA or a HSA account, you can take the money from your FSA account and pay for this. So it's absolutely no money that is coming out of your personal bank account. It's all coming out of your flexible health savings account. The important thing is, let's say the money inside there you haven't used, you had no reason to go to the doctor for a year, and it's just sitting there in your account. And I know every year, fiscal year, the employer usually top ups the account with $500 or $600 based on your job. Instead of having the money sitting inside your account, that you never know, if you lose your job, you lose the money that's on that account. You can just go ahead and make these purchases. This will stay with you forever. The thermometer is always useful to have. The pulse oximeter is always used to have. And the same goes with the blood pressure monitor and the Kardia 6-lead EKG. These are all FDA approved, and these are all information for your body. So I would highly suggest actually, to look at your finance and look at your money inside your health savings account. If you're not using it, if it's just sitting there, just go ahead and buy these things. These things are going to save you a lot of time going to the doctor unnecessarily. When you go to the doctor, you expose yourself to other conditions, so it's definitely going to save you that trip to the doctor when you can diagnose it at home, see if it's serious or not. So please continue to monitor your health savings account, and if you can afford it out of pocket, go ahead. If not, use the money in your FSA or HSA account. Subscribe to my channel, leave a comment below if you have any questions about the HSA or FSA account. I can answer that since I've used it a lot of times. Any questions about the device, you can post in the comment below, and I'll be able to do some research to answer that question. But please be safe, and I'll see you on our next video.